The Janus Joint Legacy Viewer is a read-only viewer for longitudinal patient health record data that is accessible by VA and DoD users. It was originally developed in the early 2000s by the Pacific Telehealth and Technology Hui in Honolulu in collaboration with the Tripler Army Medical Center and the VA's Pacific Islands Healthcare System. It is now an accelerator project tasked to the DoD VA Interagency Program Office by the Secretary of Defense and the Secretary of Veterans Affairs. The Janus JLV application can be accessed by all DoD and VA clinicians. From the login screen, the user can log in using either their VA or DoD credentials. Two test patients have been created for this demonstration as examples of wounded warriors that have received care in both the DoD and VA healthcare systems. Let's take a look at our patient in the ambulatory care setting. Janus JLV will display all VA patient alerts from all sites. This particular alert is indicating that this patient has multiple eligibilities. The demographics area shows all sites that have registration information on this patient. There may or may not be clinical data present. As you can see, this patient has been registered at 12 VA medical centers noted by their 3-letter site codes. This patient has also been registered at a DoD facility as indicated by the ALTA label. Throughout the application, the orange squares denote DoD facilities and the blue circles show VA points of care. In this way, all clinical information is identified by agency as well as by site. The Janus JLV user interface is customizable. These customizations will follow the user from computer to computer. Notice that the majority of the display is made up of modular data elements called widgets. The widgets are simply moved from the library onto the desktop in any of the 3 column positions. There are 16 clinical widgets that the user can select. In this way, customized desktops can be created to suit clinical and administrative needs. We'll start off by creating a new tab to name our desktop. Let's call this Documents. Let's add widgets that could be considered documents or reports. We'll do the Progress Notes widget, then the Consults widget, and the Radiology Exam widget. Each widget will display both DoD and VA data at all medical treatment facilities in an integrated chronologic display. Once again, note that orange squares are DoD and blue squares are VA. Let's take a look at a DoD note. We can easily open up a VA note as well. Janus JLV reduces the need for duplicate studies, as clinicians now have access to radiology reports from all sites. In the future, the capability to view radiology images will be implemented as well. Now let's take a look at the Meds tab. Clicking on the More button at the bottom of the Outpatient Medications widget will show us an expanded view. All widgets have a More button. Similarly, all widgets support column sorting. So we'll now sort on the Status column to display active prescriptions. Notice that the active prescriptions are now at the top of our list. Widgets also have filtering tools. In this widget, we note that we can filter by drug name or by ordering healthcare provider. Widgets also have a toolbar that provides additional capabilities. In the example of the medication widget, the copy function can be used to transfer medication information to another document. Here, we're copying the active medication list. This list can now be used for accurate and efficient medication reconciliation. The development of Janus JLV is ongoing. The next phase will further the work of the IHR Accelerators project led by the Interagency Program Office. This will incorporate standardization of terminology in 7 different clinical domains. The lab widget demonstrates the need for this. Notice that results can only be displayed from one side at a time. With terminology normalization, this means that we'll be able to display DoD and VA results like lab values on the same tables and graphs for trending. With input from DoD and VA clinicians, the JLV user interface will continue to evolve to better support patient care across agency lines.